I'm Dr. Lori Wild, Dean for the School of Health Sciences. I'm here at the new School of Health Sciences building, and I'm very eager to take you on a tour. Come on in. I'd like to welcome you to the Skills Training Lab here on the 3rd floor of our building. This entire floor is dedicated to clinical learning. We call it the Clinical Learning Lab. Behind me, you'll see some students who are practicing some procedures. NG tube placement, IV management. This is what this space is all about. It allows students the opportunity to practice skills and procedures to really build up that muscle memory that goes along with doing these skills. So at the time they are with a patient at the clinical setting, they have that in place and they can really focus not only on the procedure itself, but really pay attention to and focus on the needs of the patient, to engage with the patient in that relationship. That's really what the crux of nursing is about, and this is a place that allows them to build that foundation so they can be relational in the clinical setting. One of the things I really like about our program that I'm most proud of is the caliber of our students and our faculty. Seattle Pacific is known for developing students of competence and character, and that's what this is all about. We pride ourselves in delivering robust academics and relationship-centered learning that's grounded in Christian faith and values. There are those three things that really work together to develop a competent nurse of strong character that can provide excellent caring in the clinical setting. What this space allows us to do to develop that is to have a very realistic setting. It looks like a hospital, has 8 hospital beds. We have other equipment that is very much like what they'll see in the clinical areas, in the hospitals where they may be working. So it builds a comfort level for them before they go into those clinical settings. Again, it helps them to be more attentive to patients as people and have practiced all of those other aspects that are more technical in nature. And we couldn't be here today if it wasn't for the support of our community and especially our donors. All of the equipment that we have here, the facility itself, the space, is really dependent upon that generous support. We could not be more grateful for the opportunities it will provide our students and the patients that they're going to be caring for in the future. I'd like to welcome you to the Simulation Suite and introduce you to Emily Kelly, who is the director of our clinical learning labs, and she's going to tell you about what goes on here. Emily was very influential in the design and the setup of this suite, and I know you'll like to hear from her.
As Lori mentions, I'm Emily Kelly. I'm the director of the clinical learning lab. I'm also a certified healthcare simulation educator, and in that role, I facilitate all of our simulated learning sessions here in the simulation suite. We are currently in simulation room number 1, which is our room designed to look like a hospital room. It's set up to have features that would make it realistic as if it were a hospital room. And in this room, our students get to practice simulated scenarios. And in that scenario, they're given a patient case, they're given patient information, and then they're asked to take care of the patient and to make clinical decisions without an instructor present in the room. And the benefit of that is that they get to learn on the spot. They get to see the real-world physiologic data as they take care of the patient. They get to see it change and respond appropriately. And when we come together after the scenario, we do a debrief together, and it's really in that debrief that significant learning happens. And that's what makes us really excited about this space, because this is a space that was designed for simulation specifically, and it gives us the opportunity to create some really significant teaching and learning experiences.